Hello and welcome from all of us here at Dorothy House. In this live stream, we'll be sharing some useful tips to help alleviate COVID-19 symptoms. We're joined by Michelle Jones, who's a Dorothy House nurse specialist working out in the community. If you have any questions, please tweet these to us at Dorothy House HC or call our 24-hour advice line on 0345 0130 555. I'll now hand over to Michelle to take us through our presentation.
Hi, my name's Michelle Jones, as Kirsty said. I've worked as a nurse specialist here at Dorothy House for the last 11 years. So I'm just going to talk through some very simple ways really that you can help your family members and people you care for to manage any symptoms that are associated with the COVID-19 virus. So what are the most common symptoms that an individual may experience? Well, that could be breathlessness, a cough, a high temperature, delirium, which is sort of, agitation, and noisy breathing, so chest secretions. And we'll talk about how, we can help alleviate some of those. So in terms of breathlessness, some people will develop difficulties that lead to breathlessness. The risk of severe symptoms is higher in those with weakened immune systems, older people and people with long-term conditions. But there are some things that you can do. So you can help to get that person into a comfortable position. Sometimes leaning forward can help. Perhaps rest forward onto a few stacked pillows if you're able, just to open up the chest a bit. Let the shoulders droop. Keep the head up and the legs uncrossed, and practice some relaxation techniques, which we'll go on to. So there are a few simple exercises that can be helpful to, alleviate that panic really that can go along with feeling breathless. The first one is called blow as you go. So an example would be if you're about to stand up, breathe in as you make that effort to stand, and then when you are stood comfortably, blow slowly out. Paced breathing is another. So you can breathe in for one step and out for 2 steps as you're walking around, really sort of focusing your mind really on the breathing. And breathing a rectangle. This is a bit of a strange concept, but if you imagine, the 4 corners of a room or, a television screen, if you imagine breathing in up the left-hand side of the screen, breathing out along the horizontal bit at the top, breathe in, down the other side, breathe out along the bottom to imagine, you are breathing in a rectangular shape. Again, that just helps by focusing, the mind on the breathing and calming you down. Something that's quite helpful really is to ensure the room is not too hot. Try opening a window. The flow of air is really helpful, so the sensation of a breeze across your face can help alleviate that sensation of breathlessness. We don't recommend fans, with the virus, because it can blow the virus particles around. Another tip is to cool the face. Try using a cool flannel or a cloth on the chest area can be helpful. And if you have any medication prescribed for breathlessness, then use this. That could be half a teaspoon of Oromorph or liquid morphine, 2.5 mils. You may have been prescribed some other medication, to help keep you calm as well. So a cough seems to be another common symptom with the COVID-19 virus. And, this is looking like a new continuous cough really that's regular, lasts for more than an hour or 3 or more episodes in 24 hours. And again, sensible things to try would be, again, reducing the room temperature, open a window, being mindful really of infection control, covering the mouth and nose with a tissue. If you're sneezing, coughing, blowing or wiping your nose, make sure you wash your hands after disposing of the tissue. And encourage, that individual to drink, as much as they're able. Sometimes honey and lemon in warm water can be helpful to suppress a cough or cough sweets. Try sleeping with the head elevated, so not lying too flat. And obviously, if you do smoke, try and avoid smoking, as that can obviously exacerbate the cough. But if symptoms are not settling and you're concerned, then do seek advice from your GP or here at Dorothy House. Sometimes, a high temperature can be associated, and that can be quite unpleasant. You might see that person shivering or shaking or experiencing chills, and it's the body's way really of trying to regulate its temperature. So that is all, quite normal. That person might feel achy in their muscles and joints. Again, reduce the room temperature. Don't have the room too hot. Encourage that person to wear loose clothing. Cool the face by using a cool flannel or cloth. Encourage that person to drink as much as they're able, cool fluids. And try 2 paracetamol 4 times a day, but no more than 8 paracetamol in 24 hours, and avoid ibuprofen in this case. So delirium is something that you perhaps may not have experienced before, and it can be quite a distressing symptom if you're not sure what's going on. And it's a confusional state that can happen when someone is ill. It is a sudden change over a few hours. It doesn't tend to come on slowly or days, and it tends to vary at different times of the day. And this is all part really of the infection and the temperature. So people might present as being confused at some times, and then their normal selves at others. And those that become delirious might start behaving in ways that are unusual for them, and they might become agitated or more restless than normal, and perhaps hallucinating. All quite frightening really for the patient and for those looking after them, but it's not an uncommon thing. So what can you do? So you want to try and orientate them really to time and place, explain where they are, who they are, and provide just calm reassurance. It may be that they need to pass urine or open their bowels and they're not able to verbalize that. Avoid moving them into a different room unless absolutely necessary, because that will disorientate them further. Ensure that there's adequate lighting. Shadows and darkened rooms can play tricks on the mind if you're feeling a bit muddled and disorientated. People with dementia are more prone to becoming delirious anyway. If you or your loved one has been prescribed a drug called haloperidol, lorazepam, or olanzapine, calmly follow the instructions on the packet and try this. This can help, to calm the person. And again, if symptoms are not settling, give us a ring at Dorothy House or seek advice from your GP. So one thing that can happen, obviously, with a cough and any sort of virus of that sort is that people can get chest secretions or noisy breathing. This happens when the person is extremely unwell and is unable to clear their secretions. They just haven't got the strength. It's not painful, and often it's more distressing, to the person looking after them than it is for the patient themselves. But you can try sitting them up, getting them into a more upright position, getting them into a comfortable position, and just calmly reassure them and anyone, in the home that's looking after them. And again, give us a ring at Dorothy House, phone your GP if you just want to talk through, what to do. And just to reiterate, really, if any of the symptoms that we've talked about are not responding to the measures advised, or you feel that person is perhaps getting worse, then please contact us for further specialist advice. Our Dorothy House 24-hour advice line is 7 days a week, 24 hours a day. In the daytime, you'll get through to somebody like me. Out of hours, one of the nurses on the inpatient unit, and there's always an on-call medic to help. And that number is 0345 013 0555. Many thanks for listening.
Thank you very much, Michelle. And thank you for joining us for today's live stream. We hope you found the presentation useful. To find out more about Dorothy House, the care we provide, and how we're stepping up our support during the COVID-19 pandemic, please visit our website, dorothyhouse.org.uk. This recorded live stream and other useful resources are available online. So thank you for joining us.